Our next speaker, as you can see on the screen, is Tosun. He is from SAP in Germany and a Senior Vice President and COO for Big Data and Data Management at SAP. Xavier is a globally active leader in shaping and transforming businesses and the economy towards a new digital future. He is an executive at SAP and a member of the leadership team at the World Innovation Forum. He was instrumental in implementing an innovation culture at SAP by establishing innovation centers, strengthening the company culture through design thinking, and by developing a platform for collaboration with research, academia, customers, and startups. I also know from watching one of his videos that he's very capable of doing a handstand right in the middle of a talk. I'm not so sure that will come off on the camera today, but in any case, Xavier, good morning. It's great to see you. And as we can see from your first slide, you'll be talking about innovating to innovate to fight pandemics. And here, I'll basically hand over the floor to you, Xavier, to introduce what seems to be a very, very interesting and, of course, topical subject. Good luck.
Thank you. Thank you very much for your kind words. It's a pleasure for me to be here at the World Innovations Forum conference. So I will be talking to you about Innovate Fighting Pandemics today. Basically, you will learn how we will, at the end, wipe out pandemics for all and forever. I will address this as a later part of the talk. Before that, I want to get into how we got started. So it was in February, March. Basically, supply chains got disrupted, factories closed their productions. Healthcare systems were overwhelmed or breaking down, and countries were closing their borders. I experienced it myself. I was on the road March 14th and wanted to enter Germany through Slovakia, and they had closed the borders. So I asked the border control, what do I do now? And they just shrugged with their shoulders. So I had to figure out by myself what to do. So I drove back, and luckily the borders in Austria, they were still open. I managed to pass through. A few hours later, they were closed as well. And if I would have been a few hours later, I would have been stuck on the road somewhere for days, weeks, probably months. So it was a very difficult time, I have to say. What we also experienced was a lack of coordination, a lack of leadership around the world. Countries' healthcare systems were breaking and overwhelmed. So there was a lack of collaboration. We saw countries protecting themselves for their own, trying to figure out what to do next. And at the same time, we saw many great and new and innovative ideas popping up all around the world. And for instance, breweries started to produce hand sanitizers because there was a lack of sanitizers in the market. And in Italy, engineers started to produce ventilators out of scuba masks using 3D printing, and they published it on YouTube. In Kenya, this young gentleman, 9 years old, he invented hands-free hand washing equipment. So there was innovation happening all around the world out of necessity, and there was no place where we could coordinate and bring those ideas to other countries, as well as there were countries which went through the cycle of the pandemics already, like South Korea. They had put a whole infrastructure together with apps tracing people and with tests through driving. So they had managed this. But at the same time, there were countries struggling to figure out what's going on, managing healthcare system on the other side. And amongst this, Axel and I, we sat together virtually and discussed what can we do? What can we do to accelerate innovation, to bring those ideas together so that it's adopted and adopted among the world, distributed throughout the world, and accelerated. Basically, innovation acceleration during pandemics means saving lives. And this is where Axel and I basically discussed that we want to start an initiative called Innovate Fighting Pandemics. We built up a platform, cross domains, cross borders, cross cultures, utilizing the network of the World Innovation Forum, and also expanding and adding to that through volunteers and what we also call champions. So we have established the concept of champions. Basically, anybody who wants to be part can find himself in a specific role, being an initiator, being somebody who can manage contact, an expert and subject matter expert, or somebody who just helps organizing events or getting people on board, communicating, sharing ideas. So that is something which we have put together at the World's Innovations Forum, a network of volunteers and domain experts who can monitor and multiply ideas and best practices from around the world. We have utilized existing social media platforms for that. We are on Facebook, on Twitter, on LinkedIn, on Instagram, and for us, for you to be involved is very easy. Just write us an email, Innovate Fighting Pandemics at worldinnovationforum.org, and we will get back to you. We will include you in the process of becoming part of the innovation platform for pandemics. So I want to give you now two examples. One campaign which we started, and the other one, the project which I have mentioned, is something I'm actually very excited about, because I think this, once we get this done right, this will at the end eliminate pandemics today and in the future and forever. So not only for Corona, and for, also for a variation of this virus, as well as for any upcoming viruses. But let me start first with a campaign, which is easy. Everybody can participate. We called it Knockout 19. It's just increasing awareness of wearing masks, and also having your friends, 3 or more, wearing a mask. So that would mean if we use that, if everybody else goes out and asks 3 other friends, we would generate an exponential function, which at the end would spread faster than the virus. And by now, also there is scientific proof. There have been scientific studies which basically prove that wearing, just by covering your nose and mouth, that it reduces the infection by 75%. And if we do this on a global scale, the exponential function, everybody asks 3 or more other friends, in 19 weeks, we would reach the size of the entire world population, 7.8 billion people in the world. And by now, there are 65 countries in the world which recommend or make wearing masks mandatory, which equals a size of 5.78 billion people around the world. So there are 65 countries, but there are still countries missing in the list, not being part, or not recommending, or not making wearing masks mandatory. If you feel that it should be done and you need support with creating awareness, just contact us at Innovate Fighting Pandemics at worldinnovationsforum.org, and we will support you with your endeavor and help you to generate and increase awareness in the countries. Yeah, by doing this, it's even if we wouldn't do this on a large scale, it helps flattening the curve and supports the healthcare system, that the healthcare system is functioning and is not overwhelmed. So mask awareness is an important part of the pandemic. The other project which I want to talk to you about is actually, which I mentioned, is a project which we call massive scale testing. So what we want to do is population and population-wide testing, enable population-wide testing. This we do together with Alacris. Actually, Professor Lehrer, who founded Alacris, is a startup in Berlin. He, together with Professor George Church from Harvard, they established the concept of using next generation sequencing for testing, for basically identifying the virus. And using the capabilities of that, we can make the testing scalable and viable and feasible on a massive scale. Together with Waldner, a company which produces laboratory equipment, and they have produced containers and can support in the automation process, we can basically apply the findings or the next generation sequencing technology to scale the testing capability. So basically, the next generation sequencer today can do 20 billion reads per day. And according to Professor Lehrer, you need to have 3,000, with 3,000 reads, we can identify infected samples. That means basically we can run with just one sequencer 6 to 7 million tests a day. That we would need around 10, 12 sequencer to do the entire testing of Germany in just one day. So with this, with using the next generation sequencing technology, we can identify not only the virus, the coronavirus, as I mentioned, we can identify any variation, any mutation of the virus, as well as any new viruses in the future. So once we can put together infrastructure for a massive scale testing on a global basis, we would enable the world to run, to eliminate and to basically deal with pandemics today and in future. That's why I'm so excited about this project. It's a collaboration between many companies, as I mentioned, Alacris, Waldner, and we will add additional companies, additional subjects. This is a deep scientific project, needs experts and also specialized tools for instance, handling the sequencing, the test testing part and the tube. So for this, we can use just saliva, or so people would spit in a tube, and this would run through automated automation to enable. The goal is to enable 150 tests a second. That means we can do 10 million tests with one setup. So here is an example of Waldner. They have produced these containers end-to-end testing. The capacity is around 4,000 tests a day, and we work with Waldner together with them to apply the new techniques and technologies from the next generation sequencers to basically highly automate the testing capabilities. Tests which cost today, it varies from country to country, costs today between 160 and 60 euros, which is a high cost if you go into the massive scaling part. With this technology, we would bring that down to cents, less than euros, less than €1 and dollar, so into cents domain, which enables to makes it possible to test entire population, not only one. You would iterate multiple times. So we estimate that with 4-5 cycles, we would identify any infected person with the virus, would treat them, isolate them, and at the end eliminate the virus altogether. We work with the Robert Koch Institute. We are in the process of setting up a pilot initially for the healthcare workers, around 5 million people in Germany. So we will start that as a pilot with the healthcare workers in Germany, and then extend that. As I mentioned, this is beginning. It's a very ambitious project and exciting project, because this is not only for this virus, not for this pandemic. It solves also is a solution once we have the infrastructure ready for future pandemics. And if you think, also we were working, of course, on medicines, medications, and vaccines. And you never know. I'm confident that we will have a vaccine for the coronavirus. So we are pretty far ahead, and scientists say that we will have a successful vaccine at the end of the year. But still, there are some risks. With this, I'm confident that we will manage, but there are viruses, as you know. For instance, here an article about the HIV, when in 1986 we said the race is on for a vaccine, that we want to put a lot of money and a lot of work into developing a vaccine for HIV, and yet today, 34 years later, we still lack a vaccine for HIV. And this is the risk if we put all bets on vaccines, that it might not come. It might not come. With a massive scale test infrastructure, it would be at least easy to identify the level, the infection, the virus, isolate and put them in treatment, isolated, and then eliminate the pandemics globally. So these were just a few examples on what we do at the Innovate Fighting Pandemics, and we invite everyone in the world, everyone out there to be part of the project. Be a volunteer, help, submit ideas. If you have too much money, you can be a donator. So anything you can do is very much appreciated. You can contact us at Innovate Fighting Pandemics at World Innovations Forum, and we hope with all together we make pandemics a problem of the past and have it solved all once and for all. Thank you very much.
Thank you very much, Schafer. That was a very thought-provoking talk about pandemics in general, but also our current crisis in particular and ways of solving that. So thank you very much for your time and your thoughts. And again, if anyone would like to reach out, you've seen several hashtags and links where you can reach out, join the program, ask questions, and so on. But now we're going to move to our next startup presentation, pitch number 6 over the 2 days, the third one today.